Thanks again to Richard Belden and Source America for their support of today's discussions. We are now joined by our panelists to discuss practical solutions for increasing employment across the disability community. Welcome Rhiannon Parker, Chief Innovation Officer of the Valuable 500, a business network supporting disability inclusion. Armando Contreras is President and CEO of United Cerebral Palsy. He also serves on the board of Source America, the sponsor of today's event. And from the White House, Al-Mohamed, Director of Disability Policy for the Domestic Policy Council. Welcome to all of you.
Thank you.
Rhiannon, I want to start with you. Where are we as far as the business world and the disability community as far as employment?
I think it's really important to recognize that there's a continuum of maturity within the corporate community. So we see some exceptional progress, and we also see some organizations just starting their journey. And with the Valuable 500, it's our job to work alongside these companies and the corporate community to push them towards best practice and kind of catalyze innovation and catalyze the transfer of knowledge and innovation within that community.
And when you're talking about business, are we talking about large businesses, small business, medium, or all of the above?
So within the Valuable 500, our members are a minimum of 1,000 employees. So that's the kind of the ecosystem that we work within. But I think it's really important to acknowledge that it can be a small to medium enterprise all the way up to multinationals that are engaged in this work. You can start anywhere.
And before we go to the other panelists, just how do other companies learn from each other? Is that part of what your organization does, best practices and what works and what doesn't?
Absolutely. So we see some really cool things happening. We see innovation clustering around industry. We see innovation clustering around geography, and sometimes around a topic. So we may see organizations from completely disparate areas within our network doing some incredible work on procurement or hiring practices. And so our job is to bring those companies together and get those conversations going and progress the work.
Armando, you just released your, quote, Care for Inclusion report. Can you tell us what the findings/takeaways have been?
Yes, that's the Case for Inclusion, and that's a partnership with ANCOR and the ANCOR Foundation. Well, the findings were not really good, because what we're looking at is the plight of the direct service or the direct support professional. That one is underpaid. Second, the majority of these support professionals are either Black or Latina women, and they are the ones that are supporting those that are looking for work and those with disabilities. And that's a major part of the services that we provide. Our 56 affiliates in the United States, 2 of them in Canada. We are the ones that provide that type of service in the United States. And there is a major concern of the Medicaid reimbursement is not reimbursing to the rate that they should be getting paid for the phenomenal work that they're doing in the United States.
Well, yeah, along those lines, over 1 million home care workers make a median hourly wage of $13 an hour. What is the effect when you have that kind of a low wage on quality of care?
Well, one, it's poverty level. How can we actually begin to support people who day in and day out are with children and adults with various disabilities and pay them a meaningful wage for what they do? The issue, Bob, is that they will then look for other work, and it could be in the store, Walmart, Amazon industry, that for a few dollars more, they're actually leaving an industry that is dire to the United States and dire to the families that we support.
Day, I want to go to you as far as your position and your portfolio on the Domestic Policy Council. Can you tell us a little bit about it? I imagine some people don't know that this is a big role on the council.
Sure. In some ways, the Domestic Policy Council's job and mission is to help kind of drive the administration's policy agenda from a cross-governmental perspective, right? When we think about the federal government, we think about it as a single unit, but the problem is we've got many, many departments and agencies, and they're all slightly different. And the idea is when you want to do something big, which this president has done in many ways, when you want to push on things like mental health or access or equity, to be effective, you have to be consistent. And so in many ways, the Domestic Policy Council operates to try and ensure that kind of consistency and to drive an agenda that ensures we're all like walking the walk.
As far as working with different government agencies, as you mentioned, I mean, how is the cooperation? Is that something that you work on to come up with goals and solutions to get more people with disabilities jobs?
I'd say yes, and my role is as the director of disability policy. So basically what that means is if it covers anything to do with disability, whether that's employment, education, healthcare, all of it. And in many ways, you can't deal with an individual in one arena without seeing how it touches everything, because our lives are all interconnected to a variety of arenas. So you do end up having to do a lot of that. But I think maybe the best example of where you'll see things that the Domestic Policy Council will help drive would be in support of, let's say, the president's Executive Order 14035 on diversity, equity, inclusion, and accessibility, the EIA, which was created to cultivate a federal workforce that draws on the full diversity of a nation, right? The idea is we should look like the people. But to make that work, how do you make that work? And I think one of the first things we're looking at is that old adage, what gets measured gets done. And so over the last year, individual agencies have crafted concrete plans to embed that DEIA EO into their recruitment, their hiring, their development, and their retention of talent. It's been included in the Federal Employment Viewpoint Survey. And that sounds like a small thing, but that is the largest cross-government organizational climate survey. And it assesses how employees experience all the different policies and practices and procedures that their agency and its leadership are implementing. And like I said, about consistency to ensure it, I think I want to establish a highlight that we recently established the Chief Diversity Officer Executive Council. Many different agencies hired a Chief Diversity Officer, but if it's just working by themselves in their department or their agency, they might be doing great things, but it's not working across government. They might not be doing as great things, but this allows it to have that kind of communication. But all of these are about making sure we have a good baseline to work from. And I think one of the toughest things is many folks aren't even starting with knowledge of that demographic as it applies to disability. So that's probably the biggest example I can say about how the Domestic Policy Council can work across government, because all of those three actions are to try and make sure that as an entire federal system, we are pushing disability employment and inclusion forward together.
Rhiannon, many companies are focused on diversity and inclusion, especially after the death of George Floyd, and that's very important. You hear less talk, though, of getting people with disabilities into the workforce. Companies are not as outspoken on that, I would say. Why is that?
So I think first and foremost, there's a discomfort with understanding disability. We hear companies and individuals within those companies that are not even sure if it's okay to say the word disabled, right? So I think that very often there are good intentions, but there is just an inherent discomfort and a lack of knowledge of the disability community and the richness that is there, right? So we often hear comparisons to gender and ethnicity data, but a lack of understanding of what it actually takes to create a culture of trust, where, an employee is willing to join that organization, organizations that have the intent to do the right thing. And so they hire inclusively, but once those candidates are in, it's not a culture or an environment in which they can thrive. And so really it starts there with understanding the community. I think, We're seeing a lot of organizations on a journey, kind of starting to move away from the medical model and the charitable model, and really being well versed in the social model of disability, which is great. But what we're pushing for is the human right of disability, right? So understanding that there is nobody more well suited or no better expert on their experience of disability than a disabled individual themselves, right? So it takes a commitment, and it takes a level of comfort in just sitting amongst stuff that you don't know and acknowledging that and working with the community to listen.
So, Rhiannon, as far as finding the talent, the employee, and matching that person with the employer, what are some good programs that you've come across? What works? How do you do that?
So I think it starts with the acknowledgement that, the ways of working or what we've done in the past may not be what works now, right? So we've seen some great examples of inclusive hiring platforms. We see changes to language, changes to verbiage in hiring practices, things that people don't even understand makes a difference. So if you say, must have excellent verbal and written skills, well, is that actually something that is requisite of the role? And what can we do to change that and make that more inclusive based on what the expectations are for that individual to succeed? I think organizations that are very clear and committed to reasonable adjustments and, really making that available to everyone without a lot of admin or administrative burden on the individual, those are the ones that we're really seeing thrive and create an environment where they can recruit and retain talent. And I think certainly those that acknowledge that, the disability community deserves equitable pay and are looking at how that exists within their supply chain, asking the tough questions, are these suppliers, whether they're tier 1 or tier 2, those that are 14C certificate holders, what is going on here, right? So the ones that take an interest in the data and acknowledge that it goes beyond them as employers, but also extends to their supply chains. Those are the ones that we really see creating great working environments to attract disabled talent.
Armando, what do you think as far as policymakers, Congress, the White House, states, at the state legislature? What are you looking for? I imagine part of it is certainly passing something that would lift wages, a minimum wage to begin with, but I'll let you talk for yourself.
Yeah, it's going to be a collaborative effort of the states, federal government, to begin to look at legislation. And a couple of key points that come out of our report is, one, having grant programs to support training for people with disabilities to get into meaningful jobs. Then also what's been coming up in this dialogue amongst our affiliates, and we are going to, next year marks our 75th anniversary, is that while we've come a long way during the pandemic and during the last 2.5 years, that's been a brutal event and a point in our 75 years that has affected our staff, our support work, and we have vacancies that can be anywhere between 10, 20, 40, 50% vacancies. So we're hoping too that the Congress would expand opportunities for people entering the United States to join the support workforce. So that's another piece that we would want. The bigger piece really for us too is that Congress should pass legislation to increase the share of Medicaid funding for home and community-based services. One example is the Senator Casey and Representative Dingell, the HCBS Access Act, that will fund $400 billion, and that's with the B, to home community-based services, so that the direct service professionals can get paid an adequate and meaningful pay that they can not be in the poverty levels that I mentioned before. And that would be a major impact to people that we serve and others serve in the nation.
Day, well, that's a nice setup for you. What do you think of that legislation? It's got over 70 co-sponsors in the House, and It's got a decent amount, not yet a bipartisan bill, but is the White House open to that legislation?
I think in general, I think we know the president has been supportive of supporting home care workers, and home and community-based services in general. So I think that in general, the idea is absolutely we want to see people have the care and support they need to be successful and independent.
Dave, what do you think are the biggest obstacles that must be tackled in both the short and long term for the disabled community?
That is a very big question.
You got 10 seconds. No, I'm just kidding. No,
yeah.
take as much time as you want.
Yeah, I think the difficulty is in many ways there are many things that will make a difference when it applies to disability employment, and the problem is you can't just work in one arena. Armando talked specifically about the idea of home care supports, and if you can't get out of bed in the morning, there's absolutely no way you're going to be able to work. If you're addressing, and this is the culture that Rhiannon talked about, if we are dealing with stigma and discrimination in the workplace, then it's going to be impossible to find a job. If you can't access training and employment services, you're not going to be able to. If you can't get a good, solid education, and the problem is there are pieces of everything. And a lot of times when we're working, we end up seeing the end result and we try to fix there. But the truth is, I think we need to put effort forward a little bit in each of these areas. Actually will move it forward. When it applies to disability, just like for any other underserved or disadvantaged population, the idea is we have to start at the beginning to be successful and go, what are all the pieces that lead up to it? And unfortunately, that's not an easy answer, and it's not one that's very sexy. You know, you want to be able to say, this will do it. And the tough part is it's going to take a little bit of everything.
Dave, as far as the government agencies that you work with, I mean, are they talking to one another? And which are the key ones? I know every agency's got to focus on this, but I would imagine it's Department of Labor and HHS and perhaps a few others. And are they less siloed than they used to be on this issue?
Actually, I would say one of the things I am very, very proud of, in particular, I think this administration more than any other, the Biden-Harris administration has really reinforced the whole cross-government and all of government in many, many of its activities. And actually, I can give one really good example, which is the Department of Labor's Good Jobs Initiative. And so basically what it is Department of Labor's agencies are working with transportation, commerce, and energy to expand workforce access for all workers, including workers with disabilities. And basically, I think, I'm trying to think of the numbers. I think to date it is working collaboration to incentivize equity. It's in Good Jobs in over, I think, $97 billion of competitive grant funding, right? These are the investments from the bipartisan infrastructure bill and the Inflation Reduction Act. And so the idea is to say, what can we do to help support employment? Because the money that's going to these other agencies, it's going to be used for contracting, it's going to be for procurement, it's going to be for construction, it is building things. And we need to make sure that everyone has a piece of that. And I think in many ways, the Good Jobs Initiative is is a good exemplar of that kind of cross-government work.
Rhiannon, as far as question to you about what policymakers should do, making it easier to improve quality of life, but also maybe eliminating red tape for the business world, what do you think that policymakers should do, whether that's at the federal or state level?
I think really the policies lay the foundation for, the private sector, right? So it's really an incredible experience to work with some of the, the people laying those foundations and doing the hard work and see how that's expressed in the corporate community. So for us, it really starts with things like ending 14C and, all of the different things that we want to see happening. And then it's our job as the corporate community to basically make sure that that's articulated, right? So yeah, I think it's businesses' responsibility and the corporate community's responsibility to take policies and obviously ensure that they comply with them, but to use that as a framework or a platform to progress towards best practice. And so just looking at what Day was saying, there are many corollaries with the corporate community in ensuring ensuring the standardization of approach. And we see this particularly in regard to data. So we recently launched 5 KPIs specific to disability performance that we're asking all of our 500 companies to work towards. So these are looking at representation, so workforce representation and the percentage of the workforce that self-identify as disabled, the presence of an employee resource group, looking at what training is provided to understand and really prepare leadership for building disability inclusive organizations, setting goals, right? So disability inclusive specific goals that allow them to maintain their autonomy, but also to really commit to things that are specific to disability performance. And finally, looking at digital accessibility. So it's really important that we get this data into the ecosystem, and then we can actually look at it and measure, right? So we hear this all the time, what gets measured gets managed. So I think this is very important to understand the current state of play.
Armando, I just want to talk to you about COVID-19. You mentioned that has been devastating. It's been very difficult on so many people, so many kids, mentally, physically. Can you talk a little bit more about that? And are we coming out of that now that life is kind of back to normal?
Yeah, I'm not sure, Bob, that we're coming out of it yet. But I could say, and I want to go back to what Day had mentioned about what gets measured, gets done, or gets the awareness, is that we realize that there's data that we couldn't access, especially in the communities, the Black communities, Latino communities, African American communities, of what COVID really did. And it was devastating, where the effects, what we had called, and I think somebody had coined it, double or the triple burden of effects of people with disabilities that happen to be of color, that they didn't have access to vaccines, that they didn't have access to proper care, access to transportation. Many of them passed away. So those were the things that United Cerebral Palsy and other partners that we have, like Access, the ARC, Anchor, that we were really pushing for. Where's the issue? Where's the data? How can we make a huge difference? As far as the workforce and people providing direct services like United Cerebral Palsy, a huge impact, because the workforce was getting sick. The workforce had to rely on policies and regulations that did not allow them to go to work, for good reason, obviously, so it didn't spread. So if there are not enough care workers out there, still the case today, then that affects the quality of care for people with disabilities. So I would say that we're still far away from saying that COVID has now gone away. And then we have to deal, and thanks to the White House that has been doing a great job on this, is long COVID, right? The resources that the White House has done to bring awareness to long COVID, a new disability, actually. So there are people out there that perhaps were never categorized as having a disability, now with long COVID have a disability. So the impact from COVID was really a dire impact to people with disabilities, to our workforce, and to our affiliates and other great organizations out there that continue to provide care and vital care for and programs to people with disabilities.
Day, last question to you. Just with the aging population, we talked about the workforce issues and the pay, the low pay. This is so important. I mean, this is going to have to be addressed over the next 3 to 7 years, right? Because otherwise, we're looking at some major problems down the road.
I think at the end of the day, what I also want is folks to have long, healthy, meaningful lives, to be able to provide for their families, to work, to be productive and independent citizenry. And the idea is, right now we have a system that is based very much on what you contribute to the system. And the idea is, how do you get the best out of every individual? How can people bring their best to the table? And when you talk about a timeline for that, I'm like, I think there always feels like there's a short timeline. And I think the truth is, every generation, we're going to keep having different roadblocks and different issues, but we also have some of those same issues. And part of it is getting to that original baseline issue and making sure we have the information and the awareness, such as doing that kind of demographics tracking things, making sure we are providing information and awareness so that way people know, the idea of disability, many of our laws on disability go back to 1938 and are still on the books. So we're still operating from a model from many, many years ago. And so the idea is we should be growing and changing and evolving, and we should keep making those changes. So if you're saying we need to make changes in the next 3 years, absolutely we should. Just like the idea is we want to give everyone that kind of opportunity. And everyone talks about that cheesy idea of the American dream, but it is very real. And the idea is that we should be able to let everyone have the opportunity to reach for that. And I think in many ways that's a responsibility we all have. And I think when we talk about that culture of inclusion, right, it is not the diversity worker, it's not the disability employee whose job it is everyone. Everyone has a piece of that, because that's the only way to guarantee success, is to make sure we all can move forward together.
Great
it's
panel
not a zero-sum
discussion.
game.
We've run out of time, unfortunately, but I want to thank all three of you. Important topic, and obviously one we will continue to discuss in coming years. Thank you.
Thank you.
Thank you.